a form of treatment. And it's helpful for the typical musculoskeletal flare-ups like neck pain, back pain, a slip disc, coming back from surgery, knees, even headaches. Physical therapy is excellent as far as a treatment plan for returning you back to wholeness. There is a facet of physical therapy called pelvic therapy that is out there for patients to take advantage of and doctors to write orders for, but I think that it depends on the doctor. It depends on if the doctor is comfortable with using pelvic therapy or even if they have any understanding of the area or the region and how it works with the back, the core, the lower extremities. I think it's underutilized. So what I usually see in my clinic with regards to sports medicine is people who come in to see me obviously for new sports injuries and they don't want to have surgery or they don't want to use too many medicines. But I also see people who have been through the ringer. I've got chronic pain, for example, and they'll tell me, I've tried everything. And then I'll go into details about what they've tried, and what they tried was not everything. And then they've been dealing with pain for too long of a time just because somebody told them that's all we can do for you. Well, I've got news for you. Pelvic therapy is something that can be used that will get you to the next level. The Kegel exercises from the 70s and 80s is really outdated. Doing exercises where you contract the pelvic floor while you're at a stoplight or sitting in your chair, taking a break, it's helpful, but it's kind of very archaic in trying to get you to a better level of functioning. Having to use a panty shield because you leak a little bit when you sneeze, cough, laugh, or lift anything heavy, I think can be reasonable, but sometimes docs don't investigate further. Like, is there pain with certain movements? Do you have low back pain that has not resolved? Do you have a lower extremity gait problem, or your hip is painful? Do you have hip problems that have been diagnosed as possible surgical intervention is necessary? Do you have problems with irritable bowel syndrome? Do you have problems with recurrent respiratory tract infections because you can't cough aggressively or forcefully? These are all things that are important to consider as far as what's going on with the pelvic floor and how it can be improved upon. This is an illustration of the pelvic outlet and inlet. Essentially a low back, these are the lumbar discs, these are the hip bones, and these are the leg bones, the femurs. Then if you look down to the pelvis, there's a series of muscles that kind of come together. The musculature in the pelvis is interrelated, so there's one layer going on top of another layer. It's very important because you essentially have this bottomless cavern that if you didn't have a strong pelvic floor musculature, you would have things that would bow out. The common example would be if you have an old grandpa or an old relative that's a little bit obese, or they've had abdominal surgery, and you look at their tummy. Sometimes in the middle of the tummy you'll see this, especially when they get up or when they cough, you'll see this little ballooning out. That's because the rectus abdominis in those folks has become very thin and weak, and especially when you take a high pressure valve salve maneuver like a sneeze, cough, or bearing down, you'll see this little ballooning out effect. That there is called a ventral hernia. That can also happen in the pelvis. You'll actually see the bottom, you won't see it, but you'll feel the bottom kind of bowing out. The way that we take care of those weak pelvic areas is to usually close the legs together, tighter. And you can imagine when you have to go pee and you have to hold it, male or female, you sometimes walk around like your legs are shuffling because they're too tight together. Imagine somebody with chronic problems like that. The muscles will become overly tight, the hip muscles. And if the muscles constantly are pulled together instead of full range of motion, you'll have contracture. Eventually contracture brings some muscle pain or hip pain. So you'll have this referred amount of pain to different parts of the body. In addition, you can see the low back is right here. If the pelvic floor is weak or has trigger points, has pain that's referred to the hip or back, the lumbar spine and its muscles will do extra work. Eventually those muscles will fail. So that's why I mentioned if you have a problem with low back pain that has been through the ringer, you've been through injections, physical therapy, even surgical consult, and you have not addressed the pelvic floor, you might want to do that first, or at least get to a physical therapist that's gifted and trained in pelvic therapy. Even runners, people with abnormal gaits, if the pelvic floor is not being improved upon, strengthened, you'll probably not get to the point of maximum therapy outcome. Sometimes when you have irritable bowel syndrome, when you have incontinence, when you have pelvic pain during intercourse, it's because these muscles are not working properly. I mentioned respiratory tract infections. Well, to generate enough force in the chest, you have to have a strong abdomen. If the abdomen isn't strong as you try to cough or force air out, you'll have a bowing out of either the belly, as I mentioned in the ventral hernia, or you'll have a weakness down here, and it'll force you to not cough aggressively enough. If you don't cough aggressively enough, anybody that's had a broken rib, you'll develop a pneumonia. So when you can't develop the forces to push air out of the lungs, you have recurrent respiratory tract infections. So it's always, again, something to keep in mind if you have a patient or a relative that has recurrent problems. If the pelvic floor has not been addressed, you really have to ask. Again, some doctors will say, no, it's not that, but you really should ask your doctor for at least an evaluation. The good thing is that since the pelvic therapists who did extra training after graduating from physical therapy school, the pelvic therapists are gifted in this. They actually will, just to let you know what happens, they'll actually be trained in internal exams, not pap smears, but figuring out through an internal exam which area is weak, how it can be improved upon, how you develop your own home exercise routine to get past that failed attempt at Kegel exercises. I have no problems with Kegel, but if you're not doing an exercise program that has been prescribed and designed for you, sometimes the exercises will fall aside and you'll think of it as something that's not important. I think that's the other good thing about pelvic therapy is that when you get into a prescribed amount of visits for physical therapy, it kind of develops an engram. It develops a pathway of memory between the brain and the exercise and the muscle that can be easily brought out again. And when it's brought out again, compliance is improved. When compliance is improved, the chances of success are higher. So you can avoid that cystocele or rectocele surgery, or avoid having medicines for upper respiratory tract infection that you thought or somebody thought was just because you had COPD, or avoiding the abdominal surgery, avoiding the back surgery, avoiding the replacement of the hip, the scoping of the knee for reasons that you're not sure about. So it is important to consider the pelvis has an area of weakness. Again, there's something called a kinetic chain. It goes from the toe all the way to the top of the head. And if any link in the chain is weak, the entire chain won't be able to be sustained. So again, anytime any point in the chain is weak between the heel bone or the toe bone on the ground and the head, top of the head, that includes the back bones, the hip bones, the knee bones, the ankles, any point that's weak will ask the point above and below it to do extra work. So that's where you will, if it's a minor problem, you'll be able to kind of pick up the slack with the points above and below the weak spot. But if it's a major problem or a chronic problem, you'll see this ripple effect of dysfunction going on throughout life. And then you'll have all these other medical problems, systems won't work right, the urine won't work right, the bowels won't work right, and you'll be labeled or diagnosed when actually, if it was paid attention to, you'll actually be able to reverse this so you won't have so many other unusual medical problems. So something to consider. Just have to ask your doctor for a script to pelvic therapist. You also have to do a little bit of homework and find out who in your area has been trained in pelvic therapy. Usually it's going to be a female physical therapist. Usually most hospitals will have at least one. So I'll put a link to Pelvic Therapy Association that a lot of physical therapists will subscribe to, and you might be able to find somebody local in your area.